Hello, I'm Dr. Julie Burke, founder of Newton Chiropractic and Wellness Center. I've been in practice for more than a quarter of a century. In that period, I've watched our patients continue to take more responsibility and navigate the various roads that lead to greater health for them. Because of the changes in the landscape of insurance, sometimes it can seem difficult to navigate these roads as individuals. We have to work out how to help our patients when they are having challenges like these. Higher deductibles. Care being deemed not medically necessary. Fewer services being covered. This is why I wanted to bring you information that explores these changes so you can be knowledgeable about what is happening, take responsibility for your health, and make decisions that best support you and your family. We are using this animated format in order to, hopefully, entertain as we inform and educate. We hope you appreciate the use of lightness as we work to successfully navigate these changing times of healthcare together. Please enjoy.
Hello, I'm Johnny Curious, and this is Special Report News. We have breaking news. The landscape of health insurance has changed, and people are trying to assess what that means for them. We did an investigation so we can help the public to have a better understanding and navigate more easily. Here's what we found. With the changes from the Affordable Care Act, also known as Obamacare, Centers for Medicare and Medicaid Services report 65% of small businesses will see their premiums rise under the Affordable Care Act. For insurance to cover care, it must meet your insurance carrier's definition of medical necessity. Medical necessity is not determined by your doctor alone. Here is an example from the website of a major insurance carrier, as the policies across carriers are similar. Chiropractic maintenance therapy is not considered to be medically reasonable or necessary, and is therefore not payable. Maintenance therapy includes services that seek to prevent disease, promote health, prolong and enhance the quality of life, or maintain or prevent deterioration of a chronic condition. Most carriers require a very rapid improvement to be considered medically necessary, and many have strict limits on the number of visits allowed to attain improvement. This definition comes at a time when the declining health profile of the American people includes chronic pain, diabetes, obesity, high use of prescriptions, and shortage of funds to pay for prevention and maintenance. We have Dr. Julie Burke of Newton Chiropractic and Wellness Center to help us sort some of this out. Welcome, Dr. Burke.
Thank you, Johnny. It's great to be here.
What can your patients do in this new environment? Should we just wait until we have a real problem to get care?
This might seem like a good economic plan at first sight, but let's look at the outcome. First, we have to seriously consider the indirect costs of not functioning at your healthiest level. The hidden costs include the effect on your quality of life, your job, relationships, happiness, and even your stress level, all while the probability of allowing a condition to worsen increases. If you develop a chronic pain condition and you don't show quick, drastic changes, your care will be considered not medically necessary. And this is at a new, lower baseline of health. This means that if you are not in great condition and you don't improve very quickly, your new baseline would now be considered at this lower level of health. That is a standard that very few people would accept if they really understood it.
So how do we navigate these changes and take care of ourselves? Is there anything positive in this for us?
In the past few years, I've seen a lot of changes in health coverage. What hasn't changed is when a patient is willing to do what is needed and they are not held back by any barrier like medical necessity, we find they do much better with their health and in their life. I do see this as an opportunity to care for our health in a better way. In the past, it was customary to delegate most of the responsibility of our health and wellness decisions to our insurance. That left people short of the benefits of the potential health they could experience. Since we only get one body, it's the most important vehicle we are responsible to maintain.
Do you have any practical ways that the patients can take care of their health and manage their budgets? As healthcare often brings up concerns about costs for most people.
Being a doctor in healthcare, I started looking at how we can manage this in a way that could turn out to be an improvement, regardless of any insurance restrictions. We've created some strategies for our patients. One is to realize that you have the power to make important choices right now to keep yourself healthy. Second, when I'm talking to my patients, I often suggest to them to view their health insurance more like they view their auto insurance. Expect the more serious accidents to be covered, but maintenance of tires, oil, and cleaning up the vehicle are not covered. We could choose to never change our tires or oil, but that wouldn't make any sense because our vehicle would just break down.
So I am hearing that it makes sense for us to maintain our health so that we don't cause breakdowns.
Yes, that's it. We can use the saying, an ounce of prevention is worth a pound of cure, but the ounce is not medically necessary. So you will be responsible for maintenance if you want to enjoy a safe and comfortable ride in the body that you have.
What else do you recommend for your patients?
First, I recommend that they use their HSA and FSA as much as possible. These plans often cover supportive care, care for chronic pain conditions, and even wellness care. If massage therapy and nutritional supplements are part of your recommended care plan, you may also be able to use the HSA dollars to reach an even higher level of health. This is really great news in an environment where we are working to help patients attain their best health instead of simply managing catastrophic situations. Remember, insurance was not designed to help us reach our optimal level of health.
Are there plans available to make healthcare easier to manage?
I took this path very seriously as I knew it would be the best way to support my patients in getting the health care they need truly affordably. What we realized was that there are two approaches to most problems in life. There is long-term or corrective care where we take the necessary steps to correct a problem for a long period of time. And there are short-term or relief care where we are simply seeking relief, often just putting a patch on an underlying problem. Relief care is aimed at relieving the symptoms. Corrective care is designed to address the underlying problems. Relief care appears to be the less expensive approach. However, over time, it typically is not.
And it sounds like we're talking about the problems of not maintaining your vehicle again.
That's exactly right, Johnny. If the alignment in the front end of your car is out, you could keep replacing the tire as it goes bald. This is relief care. In the short run, it might look like this saves money or time, but it doesn't, as it's only temporary. When you fix the alignment and correct the problem, it may cost a little more now. However, in the long run, you actually save more and enjoy the ride.
Not to mention, your vehicle is operating the way it's supposed to be and not breaking down. Nobody likes to be on the sidelines with a broken down car or body.
Yes, you are absolutely right. In regards to something as important as your health, the choice to receive temporary relief or do a full correction is very important. Unlike a tire, which you can easily buy and replace, you cannot easily replace organs and tissues which have failed to function. Without your health, it is almost impossible to enjoy life to its fullest or work to your capacity. It is therefore recommended, whenever possible, to correct the cause of your problems.
This seems like an obvious approach to our healthcare. Can you give our audience an idea of what they could expect if they did decide to correct and maintain their health?
Certainly, Johnny. When someone comes to our practice, they are thoroughly assessed, including testing with state-of-the-art equipment. This supports your doctor in diagnosing your current condition and measuring your improvement. These are some of the examples of the measurements that reveal your current state of health. The doctor will take that information and diagnose based on your current condition and pain level, taking into consideration your overall structural integrity and your observed response to treatment. We have created very specific care plans to match the condition you are in and help you reach your goals. Most plans will include the following phases. Relief care is intensive care, which brings improvements to posture and handling stress. Corrective care is designed to more deeply address the underlying patterns while establishing a much higher baseline for health and function. Optimizing care is aimed at helping you retain the gains you have made during the corrective phase, like a retainer that helps the teeth stay straight after wearing braces. After we've achieved this new baseline for health and corrected what life has done to us, we maintain that with less frequent visits in our wellness programs. This helps us to work out the stress and knocks in life as they happen and before they bring us down to lower health levels again.
This sounds like the equivalent of doing the major work on the car, like an engine overhaul, so that the car can be maintained the way that it was supposed to be after that?
That's correct. We don't have to know we have a problem to be negatively affected by it. It is always better to assess so we know what's happening. This way we can correct even small problems, maintain our health, and have a better experience in life.
Well, thank you, Dr. Burke, for helping us to navigate the confusion around health coverage. There certainly have been a lot of changes. Thankfully, the statistics show that the trend has been for people to take more responsibility for their health care. As more and more of us take this step, we should see an improvement in our health as a nation and as individuals.
Thank you for having me on your program.
Next up is the weather. Jane?
We hope that you've enjoyed this and discovered what you need to make great decisions around your health. We will continue to work tirelessly to make the resources that you need available at a price that is as affordable as possible. We are so happy to celebrate the health goals our patients achieve, and we're committed to making that available to anyone who aspires to enjoy great health.
Bye.